Critical Thinking and Coding Tips for Chapter 12. Our first critical thinking question: what are the differences between type 1 and type 2 diabetes? Why are the terms insulin dependent and non-insulin dependent no longer used? And our answer: type 1 diabetics are always insulin dependent, and typically the condition develops earlier in life, which is where the term juvenile diabetes comes from. Type 2 diabetes is usually adult onset, and these patients may be insulin dependent. Both type 1 and type 2 diabetics can be insulin dependent, so that would not be the determining factor in deciding what type of diabetes a patient has. Type 2 diabetes is much more common. If the documentation does not specify the type of diabetes and whether a patient is on insulin, the default is type 2 diabetes. Next question: what are the differences between volume depletion, dehydration, and hypovolemia? And our answer: the definitions are as follows. Volume depletion is reduced fluid in the cells, including water and salt. Dehydration is the loss of water from the body without salt loss. Salt is retained. Hypovolemia is an abnormal decrease in blood volume or plasma. A coder should never determine a code on the basis of laboratory findings alone. The physician must document the specific condition for it to be coded. However, these guidelines can certainly help a coder understand what a physician is trying to say, or they can help a coder with the query development. And our final critical thinking question: why is obesity an important diagnosis to code? And our answer: obesity can cause many complications, and so it's important to code it as a secondary diagnosis when documented. As stated in earlier chapters, coded data are used by many entities and organizations for billing and data collection purposes. Research studies can use coded data to show the relationship between obesity and its complications. Some of the following complications are related to obesity. Diabetes and hypertension can be a result of weight gain. Both of these conditions can lead to heart disease and stroke. Depression can result because of a patient being obese and unable to lose weight. Obesity can also affect patients who already have osteoarthritis because they may be unable to perform physical therapy to help treat their osteoarthritis and/or rehabilitate from orthopedic surgeries. Okay, now we'll cover a few coding tips for this chapter. Review the coding guidelines beginning on page 311 for coding diabetes. A code from the category of 250 must have a fifth digit assigned to make it a valid code. In other words, pay attention to the red stop signs following codes. Also, make a note that if the type of diabetes, mellitus DM, is not documented in the medical record, the default used is type 2. Now, what is wrong with these groups of codes? Assume the first listed diagnosis is the principal. In your first group, what is wrong with these is that there are inconsistent use of fifth digits. All fifth digits must be the same, whether it be 0, 1, or 2. The next group, what's wrong with this set of codes is that you need to review the record, determine what renal manifestation is associated with the code 250.40. It cannot be coded alone. In the final group, you see the first code is italicized. What's wrong with this set is that you cannot use the manifestation code, which is the code in italics, as the principal diagnosis. 250.51 should be the principal, followed by the code for the manifestation, which is 362.01. Continuing on with some coding tips. The better understanding coders have of all common manifestations and complications of diabetes, the more confidence they will have with coding diabetes. You need to review the diabetes section of the book and review which diabetes codes are complications and or comorbidities and which are not. Guidelines are that all uncontrolled diabetes are complications and or comorbidities, as well as type 1 diabetes. Type 2, not stated as uncontrolled, is not a CC. Now, cystic fibrosis is a genetic condition and currently has no cure. When a patient is admitted with a complication of a disease, the coder should code the complication as the principal diagnosis with cystic fibrosis as a secondary. This does not follow the conventional guidelines for etiology and/or manifestation coding, Section 1A6, which state that if the etiology of a complication is known, code the etiology first, as in diabetes, and that this is an exception to the rule and something the coder must be aware of when coding this condition. And finally, common complications of diabetes is ketoacidosis, renal, peripheral vascular, ophthalmic, neurological, and osteomyelitis. So what fourth digits are used for each of these complications? And finally, dehydration might be apparent by the treatment and laboratory findings but not documented by the physician. If a patient is being given IV fluids and there are electrolyte imbalances, it's appropriate to query the physician as to whether the patient has dehydration. The same is true for hypovolemia or volume depletion. This is a commonly overlooked complication and or comorbidity, and one that can also be a physician education opportunity.